Welcome back. Oftentimes we hear how cardiac arrest hits out of nowhere, but new research reveals about half of patients feel symptoms way before their attack. Dr. Parvan Karnati with the Lakeway Regional Medical Center is here this morning with us to talk about this new study as we head into Heart Month. Good morning to you.
Good morning.
Let's start off by setting the record straight, because a lot of people think that cardiac arrest is the same thing as a heart attack, but you're telling me they're two different things. So what is the difference, and then what is cardiac arrest?
Actually, cardiac arrest is actually sudden cardiac death where there is sudden collapse which is due to heart stoppage, whereas heart attack you actually develop because there is a blocked heart artery and that needs to be opened right away. If you don't take care of it, in some cases it can result in sudden cardiac arrest.
Got it. So cardiac arrest always ends in death?
Yes, not always.
Okay.
In most cases, about 93% of the time, the survival from sudden cardiac death is actually 7% on an average.
That is a very, very high percentage there. This new study came out and said, you know what, it might not be so sudden as we think. There were patients who had gone into cardiac arrest who were interviewed, and it turned out that they had seen some signs early on.
That's exactly right. This study was actually published in Annals of Internal Medicine in January. They looked into about 839 patients and looked in to see if they had any warning signs within 4 weeks prior to the event. And they've noted that 51% of them had warning signs like chest pain or shortness of breath or any uncomfortable feeling in the chest. And actually out of them, 81% actually had recurrence 24 hours prior to the sudden cardiac death. Only 19% actually called 911 or seek medical attention, and actually survival was better in those patients.
Only 19% of those who experienced warning signs, not once, but some of them it came back again 24 hours before the cardiac arrest hit.
That's exactly right.
Wow.
It's like actually being aware of heart-related symptoms and taking action that changes the outcomes in most of the cases.
So what, in a perfect world, what should those patients have done differently? Who should your first call be?
So depending on how bad your symptoms are, let's say you get chest pain, you take a nitro, and if it is not going away, you take another one. If it is still not going away, then you have to call 911 and go to the emergency room. That would be the best step, I would say. But if you're having some uncomfortable feeling in the chest, you're not sure, call your cardiologist or your regular doctor right away. But sometimes if they cannot be reached, I would not take any chances. Call the 911, go to the emergency room. We're there to serve you.
Yeah, a couple of years ago, I did a story, I believe it was at the Heart Hospital of Austin, but they were talking about how seconds count. And in a lot of these cardiac arrest cases, they will fly a helicopter to you, basically, to get you to the hospital faster.
Okay. Yes, time is muscle, so we don't take any chances. There is the faster you open a blocked artery or faster you act on something related to the heart, the outcomes are better.
And another thing that could help get you ahead of the game, you guys are holding a heart screening today at the Lakeway Regional Medical Center between 10 a.m. and 2 p.m. cardiovascular screenings.
That's right. We are actually going to invite all the public to come in today. We are doing some free screenings, and also we're going to talk to people about the cardiovascular services we provide at Lakeway Regional Medical Center.
All right, they're absolutely free. We will have the address on our website at kxan.com with this interview. We'll post it in just a few minutes. Thank you, Doctor, so much for being with us this morning.